Hello, everyone. This is Chase Glenn from the Alliance for Full Acceptance. Hopefully, you can see me right now. And this is a new sort of platform for me. I'm used to doing these sorts of calls for meetings, but haven't necessarily done them with a large group of folks. So feel free to utilize the chat if you'd like to speak to folks in the group. You can also unmute your line and speak freely if you'd like to do that as well. So today's topic is obviously timely for many folks right now who are going through some uncertain times, especially if you are experiencing changes in your employment. You may be in a situation where you've recently lost coverage, health insurance coverage. You may be in a situation where you are thinking you need to change coverage. And so the thought here is we wanted to provide a platform for you to interact with someone who knows this topic very well. And that person today is Shelli Quenga from the Palmetto Project. Hello, Shelley.
Grace, how are you?
Hey, good. It works. We're doing this. Great. Thank you so much for being here today. I will let you go ahead and introduce yourself. Tell us more about what you do, who you are, and if you want to go in and get started with your presentation, go for it.
Sure. Okay. Well, I do have some slides here, so I think I can share my screen, right?
Yeah, should be able to.
Alrighty. I think I can. So I have this computer there we go. And we're here. Okay. So the Palmetto Project, I hope that you guys know that we have been around for over 30 years. We are a statewide nonprofit in South Carolina. So we were started to work on issues where South Carolina is generally falling behind other states. And so those have traditionally been healthcare, civic engagement, education, other family, community, economic development issues. And so for the last few years, I've been working at Palmetto Project in the healthcare sphere, but I hope that you guys all know us because you have been to vote and you have received one of our I voted stickers. And so I'm very thankful that our primary happened a few months ago, and I hope you got your sticker then before all of this started, and that hopefully by the time November rolls around, we'll be ready for the general election in November, and you'll get another sticker then. One of the other programs you might know us for is Dolly Parton's Imagination Library. So that is a free book by mail program for children under the age of 5, and Palmetto Project is the statewide affiliate for that program. So one of the things Dolly is doing during the pandemic is she's actually doing story time with Dolly. So you can certainly look out for her. She's pretty big on the Twitters and on the Facebooks. So you can look out for Dolly reading stories out loud. So those are so great. And then the program that I've been leading for the past few years is called Insure South Carolina. And so that's really how I've come to gain all of this knowledge and this experience working with folks who need insurance in South Carolina. So we started a nonprofit insurance agency, the first in the nation statewide nonprofit insurance agency. So I'm actually a licensed insurance agent, and I don't have any horns up here in this hair. So I sometimes feel like maybe people are thinking I'm like a used car salesman, but there are great advantages to being a licensed insurance agent. And one of those is that we can help people with all different kinds of health insurance, including Medicare, the Affordable Care Act, plans outside the marketplace. And then because we are a nonprofit and we started out helping people with Medicaid, we continue to do that Medicaid work. It is a very important component of coverage in the state of South Carolina. Over half of our kids are covered by Medicaid in our state. We have terrific Medicaid coverage in our state for kids, not so great for adults, and so we'll touch on that a little bit today. What I know that is really at the top of everyone's mind right now is fear of losing coverage because you're fearful of losing your job during this time, or you may have already lost your job, and that means you're going to lose your employer-based coverage. So wanted to reassure everyone that as you go through this process and this time, you are eligible for what's called a special enrollment period if you have lost your employer-sponsored coverage, or you know that you are going to lose your employer-sponsored coverage. So there is a 60-day window before you lose your coverage and after you lose your coverage in which you can sign up for a plan in the Affordable Care Act or off the marketplace for a private plan if you would rather do that. And rates, the premium rates, the monthly bill that you get every month is almost always lower in the marketplace than it is through COBRA. So when your job offers you COBRA coverage, what they are offering you is the ability to continue in your employer-based coverage, but with you paying 100% of the premium. For most of us, typically our employer will pay 50% or more of the total premium. But with COBRA, you're now being stuck with the entire monthly premium bill. And for most of us, that's usually unaffordable. You don't get any kind of financial assistance to continue your employer-based coverage through COBRA. You do with the marketplace. A lot of times we've had people come to us and say, well, I went ahead and I signed up for COBRA when I was exiting my job, and I figured I'd wait until later and look at the marketplace and see if that was a good fit for me. That is not the way to handle this situation, because once you sign on the dotted line and elect COBRA, you cannot then sign up for the marketplace and drop the COBRA coverage and move to marketplace. So it's really important that you get all of the facts first and then decide if you want to go with COBRA or if you want to go with the marketplace. Now, for marketplace coverage, thinking about your income, if you are doing this yourself, if you're going to healthcare.gov and you're going to do this yourself, you need to think about how to count your income. So the marketplace is going to look at all of the income that you've made so far from your job or jobs. Then it's going to also include any projected unemployment insurance that you are going to receive. And it is going to include the extra $600 weekly payments that you are eligible to receive from unemployment through July 31st. So it's going to look at all of the income that you may earn during the 2020 year. So it's a projection of what you think you're going to earn. So it is not an easy projection to come upon if you are working a couple part-time jobs, if you are a self-employed person, if you've lost your job and you're not sure when you're going to start another job. So that's why we really advise you to get some help. But if you want to go it on your own, make sure that you know these things. And the other important part is that child support that you may be receiving is not counted as income. It's not taxable to you as income, so therefore it's not included. Now, Medicaid in the state of South Carolina is really only an option for adults if you are disabled, if you are over the age of 65, if you are blind, or if your income is very low and you have children under the age of 19. So we would say that generally for a healthy adult who is childless, there is no Medicaid coverage for you. But if you have children under the age of 19, Medicaid only counts your income for the last 4 weeks. So now that we've gotten into several weeks of this pandemic, your income may be greatly reduced. You may not have started to receive your unemployment payments yet. So you may, as an adult, be eligible for Medicaid if you have children. Now, once you start receiving your unemployment, those regular unemployment payments that are up to $326, those payments that could last as long as 33 weeks are counted for Medicaid and the marketplace. But that $600 extra unemployment insurance payment that you could get through July 31st is not counted for Medicaid eligibility. And again, remember that child support is not counted as income for Medicaid or the marketplace. Now, I wanted to include just a little bit about Medicare because we may have people who are over 65, but they were working, they had job-based coverage, so they had that employer-sponsored coverage, but now they're losing that employer-sponsored coverage over 65. You are eligible then to join Medicare, even if you are, you're 70 years old and now you've lost your employer-sponsored coverage, you can then jump into Medicare coverage. If you are getting ready to turn 65, sometime in the next 3 months, you can sign up for Medicare, and that will start the month of your 65th birthday. Now, the downside of Medicare is that's going to cover the person who's 65 or older, but it is not going to help any of your family members who may have been covered by your employer-sponsored plan, your dependents. So you still may have a mix of coverage and have some of your family might be covered by Medicare, some might be covered by marketplace coverage, and then if you happen to have children under the age of 19, they may even be covered by Medicaid. So it's possible to be in one family and have 3 different types of coverage. Now, for those of you who don't have kids under the age of 19, you were never enrolled in coverage, so you didn't lose coverage, and you're not turning 65 and eligible for Medicare, so you're generally probably a childless adult who is working a couple part-time jobs. You will then start to receive that unemployment income. That may then put you over a $12,490 income. If that puts you over that income now with that extra unemployment income, you are now eligible for marketplace coverage. Now, to get that marketplace coverage, I'm going to tell you that you need to have an advocate to make this call with you. This is a very difficult special enrollment to get. When we call the marketplace, they will 100% of the time say, no, you're not eligible. And we have to say, well, in South Carolina, we don't have Medicaid. We go through all this rigmarole, and we have to escalate it up and wait and do an appeal. So I strongly encourage you, if you are in this situation where your income is actually going to go up because of unemployment income, you need to call either an agent or a navigator up in Greenville area or a certified application counselor at a community health center to help you through that process, because it is not an easy one, but you could get marketplace coverage. Now, I want to talk a little about, oops, that one I think shouldn't be in here. I want to talk a little bit about affordability, because I do want people to know that with the marketplace, especially those folks whose income had been under this $12,490, you may have looked at the marketplace last fall and said, wow, this is going to cost me $500 a month. That was because your income was too low and you weren't eligible for any tax credit. But now that your income is above $12,490, there are plans that have 0 premium. There are plans that have $5 premiums. There are plans that have $25 premiums. So, as long as your income is in that ballpark, this is a worthy endeavor, I think. It is time for you to look and see if you qualify, because you just don't know until you try. And it's free to look, it's free to shop. And until you actually enroll in a plan and pay the premium, no money is going out of your pocket to shop and to see what you're eligible for. So you don't have to pay anything to apply. You don't have to pay anything to get help. from an agent, from a navigator, from a certified application counselor. All of our help at Palmetto Project is free. So it is worth it, I think, to see what you're eligible for at this point. So let me see, we'll skip to that one. So that is my contact information. So that is my direct number. I will receive those calls, and that is my email address. So you are able to email me any questions or call me with any questions. People's situations are so different that we really encourage you to call and just spill it. Tell us what it is. Tell us who the folks are who are in your house. The definition of family is different between Medicaid and Marketplace. So we need to know who's on your tax return, who is in your household, who's not on your tax return. We can work out different situations and say, well, here's what would happen if you do put this person on your tax return. Here's what happens if you leave this person off of your tax return. So all of those are situations that we can run through as an agent. That the Marketplace, if you just made that direct call to healthcare.gov, they cannot run those scenarios for you. They are working off of a call script. So they are very confined in what they're able to discuss with you and the information that they're able to share. We, on the other hand, are not confined to a phone script. So we have time to talk about all the different options that you may have to make this affordable for you and make it work for your family.
All right. Wow, Shelley, this is amazing information and really helpful. It's probably really easy to get overwhelmed by all the details. I know just in the 6 slides or whatever you just shared, I'm like, wow, I feel like I'm really glad that we're recording this so that we can share it with folks later. And I can even myself review it again. I want to give people the opportunity to ask questions on their own. And feel free to, you can type your question into the chat if you have something that you'd like to ask. You could also just speak up if you want to, if you feel comfortable, shouting your question out. I've got a few that I just have off the top of my head. Like I said, it's this can be really overwhelming, just the information alone. But when you think about someone who's also going through some pretty uncertain circumstances and you're already emotionally going through a lot, this is just something else on top of it that you're having to deal with. So you shared a slide that kind of gave some options that for someone who has maybe recently lost their job, been laid off or furloughed, and there's a lot of different terms out there for how a company may decide to handle the situation. Some people are just all out, just letting people go completely, not to use the word fired, but terminating the employment. Some people are being furloughed, some people are being laid off. If this has happened to me and I have been notified that I'm no longer going to have health insurance benefits through my employer, what is my first step to getting to a place where I feel like I am able to have coverage again?
Well, to your first point of, so many stressors at this point and so many things that are swirling around, we know that you want to deal with first things first. We're worried about rent and mortgages. We're worried about, putting food on the table every day. And so we understand that those are things that are important. So, the important thing when you're losing your health insurance coverage, though, is that you just have this 60-day window. And that's really the most important thing to think about. If you happen to know ahead of time, so for example, we know that MUSC and Boeing, announced yesterday that they were going to do some furloughs and some layoffs, and people are going to lose coverage. If you know ahead of time that you're going to lose your coverage now in the middle of the month, the soonest you can get coverage started with the Marketplace is the first of the month of next month, so the 1st of May. If you wait, which you could wait until after May because you'd still be within that 60-day window, you could wait, but then your coverage wouldn't start until June 1. So your Marketplace coverage can only begin on the first day of the month. So really, as soon as you can, it's important to give someone a call and get that application started, because it is a process for special enrollment period. We can't seem to find any rhyme or reason to it, but for some people who apply for a special enrollment period because they've lost job-based coverage, some people are required to submit documentation of that loss of coverage. Now, that could come from a COBRA letter that they've sent you. It could come from a letter from your employer, a certificate of creditable coverage that you will receive once your coverage has ended. But some people are being required to submit that kind of documentation. So your coverage could be delayed in its final approval until that paperwork is received. Other people, I seriously don't know why. Other people, we can do the application. It requires no additional document submission, and they can enroll, and everything would start no problem on the very first of the next month. So the sooner you start it, the better.
That's great. Great information. Thank you. I'm thinking about, let's see here. I'm fearful, and you covered this somewhat. So if this is redundant, forgive me. But I'm fearful that I'm going to lose my employer-sponsored insurance. What can I do right now to be prepared? Say I don't know that this is going to happen for sure, but I have my coverage currently. I'm fearful that I've heard something might be coming down the pike. Is there anything I can do right now to be prepared if I
Yeah.
get that news?
Yeah, I think, you can go ahead and shop now. So you could go ahead and look at what the price of plans would be right now without ever, hitting the submit button and being enrolled in something. So you would have an idea in the back of your mind as you're trying to figure out what your new budget is going to be. You would already know, okay, well, my health insurance premium is going to be $50 or it's going to be $5. We could talk already about what the different networks are with the different health insurance plans in the marketplace, what the cost of your medications could be, because we can look that up. So you would know what those copays were going to be already.
That's good. Do your homework now then.
Yeah.
So what happens then if I get, I lose my job, I get new coverage through the process that you've explained, but then I find out that now I'm being hired back into my job when, this is all past, hopefully
Right.
sooner rather than later. What happens then? So I've got this new coverage that maybe isn't as good or is more expensive or something that, that I want to go back to my employer's based insurance. What do I do then?
Yeah, so then as soon as you know the date that your coverage is going to start, then we can go into your marketplace account and we can schedule it to terminate on the last day of the month. And then your new coverage would start on the first of the next month. So then you would have no gap in coverage, with the goal being going forward that you wouldn't have any additional gap. Now, another situation might be that you've lost your employer-based coverage entirely, and that job is not coming back and you're actually going to a new job. Most of the time when we start a new job, you have a 60-day waiting time before your new coverage can start. So you would actually be able to keep your marketplace coverage for that 60-day window, and then you would stop it that last day of the month before your employer coverage would start on the first. So literally zero gap in coverage as you were starting your new employer coverage.
And that's the ideal situation, right? Zero gap in
Absolutely.
coverage. Right.
Absolutely. Yeah, I mean, I think one of the other things that is difficult oftentimes for folks who are losing their coverage is finding out the exact date that your coverage is going to stop. Because, I know for my company, we pay our premiums 1 month ahead. Most companies do. So typically my coverage should last through the last day of the month. But that is not true for all companies. That's not true for everyone. So some people's coverage does end on the pay period. Some people's ends on the day that they're let go. So knowing what that last day of coverage is, I would want to make sure that that is clear to me when I'm going through an exit interview.
Hmm. I'm going to pause here for a moment, make sure I'm not speaking over anyone else who'd like to get a question in. I can keep going though, so. All right. Well, again, feel free to, if you don't want to speak up and say your question out loud, feel free to put that in the chat. And also, you, of course, have Shelly's contact information. She's already generously provided. So if there's a situation where you want to reach out privately, I don't want to assume here, Shelly, but I'm guessing it's okay for someone to reach out.
Absolutely. Yeah. In the chat box too, so that it's here in case everybody didn't touch it in the slides.
Okay, great.
May I ask a question?
Yes, please.
Okay. My kids currently have a vendor in Medicaid. Do your services offer me the opportunity to maybe switch to another one? Because I've had a hard time finding ophthalmologists under this certain plan.
Okay.
And I would like to get something else.
Yeah, so typically with Medicaid, once you've chosen a managed care plan, you are not allowed to switch until the beginning of the next coverage year. However, they do, there are exceptions to that rule, as there are to most every rule. So you can request to be switched, and that reasoning that you have, you know, in that there is no ophthalmologist that is within, you know, X mile range of my residence, that would be a valid reason to want to change the Medicaid managed care organization that you're with right now. So I would fight to appeal that, and that you do, you should be eligible to change that MCO, even though you're in the middle of a coverage year.
That's great. That's good information.
Thanks.
You're welcome.
I just wanted to ask, because of all the paperwork it sounds like there is to deal with the insurance process and what's going on out there, do we have to come in and meet you in the office to go over this?
No, you've got to come here into my bedroom where I'm sitting up this camera right now. No, actually, we are, yeah, awkward. We are actually able to help people over the phone. So for the marketplace, we can do almost everything over the phone. If there are documents that need to be submitted, those can be sent to us. You know, you can take a picture and text it to us. You can email it to us. So everything is secure and compliant, so you don't have to worry about that. And then we will submit those documents for you. For some other systems like Medicare, we actually have an electronic signature process for some of those documents. For Medicaid, some of them we will actually snail mail you a form that you have to sign, and then you can either mail it back to us or take a picture of it and send it to us, and then we can be your authorized representative for the Medicaid process too. So no human interaction required.
We can continue to social distance even in this process.
Absolutely.
That's good. So I know there's always been, you know, a lot of conversation around pre-existing conditions, and whether it's, you know, asthma or depression, anxiety, diabetes, any number of conditions where we've received care in the past. I know there's always been this conversation around concern about whether or not I can get coverage now, even though I've got these pre-existing conditions. Is that a concern that we should have right now?
It is not for the marketplace. It is not for your employer-sponsored coverage. So if you were to go from one employer to another employer, you don't need to worry about that. If you were to go from employer-sponsored coverage to the marketplace, the only health question that you can be asked for an Affordable Care Act compliant plan, so that includes my employer-sponsored coverage that I have, and the plans through the marketplace. If they ask you any question about your health besides, am I a smoker, then that is not a compliant plan. If they ask you any questions about your weight, when you've been to the doctor last, any other conditions that you have, then you should beware, because that is most likely a short-term limited duration plan. And they are very, very sneaky when they are trying to sell you those plans. So if you make the mistake of going to healthcare.com instead of healthcare.gov, you will be spammed till the cows come home of people who are trying to sell you non-compliant short-term plans. Now, there's a role for short-term plans for some people, but it is a very, very small number of people that these are good for. They do not cover pre-existing conditions. I don't care what they tell you. They do not cover pre-existing conditions. They do not cover prescriptions. So if they're asking you any questions about your medical history, that is not a plan that you want. That is not a compliant plan. So the only question we are allowed to ask is, do you smoke or do you use tobacco products more than 4 times a week? That is the definition of a smoker, according to the Affordable Care Act. Vaping does count. So if you use a vaping product more than 4 times a week, that is also considered a smoker. But you do not have to worry at all. You know, I have a friend who gets her T-shots. We don't have to worry about those. If he's going to transition, you know, out of his job-based coverage into a marketplace plan, those will be covered. So we don't have to worry about that.
Well, that was going to be one of my questions was, you know, I'm a trans man. I, you know, take testosterone to give myself an injection every 2 weeks. That's actually not covered on my insurance plan. So that's not a good example as far as apples to apples, but for someone who does have that coverage already on their plan, they may be nervous about losing that and what that means. You know, are there plans in the marketplace where people's trans folks' hormone replacement therapy is covered?
Yes. So for most folks, the HRT is covered as long as it is an injectable. So if it's a cream, if there's any kind of cream that's compounded, those are not covered for any of us. So even me as a postmenopausal woman, my HRT is not covered by my employer-sponsored plan either. So, but if it is an injectable, then yes, it is covered.
That's great. Any other questions out there from folks? So what I'm hearing is, well, I do have one last question here, and I thought this one was a good one that is addresses something that a lot of us have heard, and we're never really sure. You don't want to have to find out the wrong way. But if I get sick and I'm uninsured, and I have to go, say, to the emergency room, you know, we've heard the hospitals have to care for me even if I'm uninsured. So 2 questions there. One, you know, I get billed and maybe I don't have anywhere close to the amount of money they're telling me I have to pay. What can I do then? Am I just constantly going to be running away from that bill? And 2, if I'm going to get treated in the hospital, if they have to treat me, if that is in fact true, why should I bother paying for health insurance? And that maybe I should have asked those questions in reverse, because the answer to the first one may tell me why I shouldn't bother.
Right. So, you know, and it depends on what you're going for. So what the president has said recently is that if you are uninsured and you are going to the hospital to be tested for the coronavirus and you are found to be positive for it, then you do not need to worry about the bill because that will be covered as long as that's taking place at a hospital. So, and as long as you are found positive. If you are tested and you are found negative, if they say, actually, this is just the flu, at this moment, right now, that bill will not be covered. So you will still receive a bill. Now, you know, the long-held belief that, well, if I just go to the ER, then they have to treat me and I'm not going to be billed. They do have to treat you. So we don't turn anyone away in our country when they show up in an emergency room for emergency treatment, okay? So if you are sick and you require a bone to be set right away, blood is, you know, as I tell my kids, if blood is squirting and bones are sticking out, that's an emergency. So yes, they're going to treat you, but the follow-up care is not covered. And most of the ER physicians are not actually employees of the hospital. They are contract employees who are employed by an emergency physicians group that is outside the hospital. So you're going to get a separate bill for those. So what we know right now is that even if you are found positive, the hospital bill will be taken care of, but those extra doctor's bills, those will not. So you will still be receiving a bill for those other doctor's bills or for other treatment. You know, the other thing that we don't know is that the president has said, you know, yes, you're going to be treated and you're not going to have to worry about a bill if you're found positive. But we know, and this is very important for us in the South, most of us have another comorbid condition. We have diabetes, or we have heart disease, or high cholesterol, or we are obese. Those will complicate treatment and require additional medical treatments. We don't know if that treatment will be covered in the same way that my coronavirus treatment will be covered. You know, there's no doctor who's going to say, hey, your glucose level is out of control, but can't treat that while you're in here because I'm only getting paid for treating your coronavirus. They're going to treat your diabetes, but then you're going to be footing the bill for that. Now, what happens with that bill afterwards? It is going to follow you forever. You can apply to the hospital's financial assistance to have some of that bill written off, to work out a payment plan. And as long as you are adhering to the payment plan that you've agreed to, then they won't send you to collections. But it could be a bill that will follow you for a very, very long time. And certainly if you were getting treatment at a state facility like an MUSC, then they're also able to come after you and get your tax refund from any state taxes too. So, you know, you may not see a tax refund from the state for a very long time. So if you are uninsured, I would suggest, like right now, I know that FEDER Healthcare, which is our community health center, has recently opened up a testing site in Moncks Corner. I expect that they're going to open up some other testing sites soon. If you were to go to FEDER for your testing, because FEDER is a federally qualified health center, if you are uninsured, they will work out a payment plan with you. And if you are not able to follow through on that payment plan, they can work with you to adjust that, but you will never be sent to collections by FEDER. So for any type of healthcare, if you are uninsured, I strongly encourage you to seek out your community health center, even if it's only for that long-term financial protection, that bill is not going to affect your credit history. And I'm on the board of FEDER, and so, you know, certainly I don't want to encourage people not to pay their bills, but that is an important consideration when you're thinking about your long-term financial future.
Mm-hmm. For sure. Wow. Well, again, so much really great information here. I want to pause for a moment again and just allow anyone else to chime in or put your question in the chat if you have any other questions for Shelley. Shelley, is there anything you feel like you didn't get a chance to say today that you'd like to make sure we hear?
Well, I think, you know, I'm probably pretty biased that I have a pretty awesome team of folks who are all working from home, taking calls, helping people. Please use them. They are as expert and savvy as I am about this. That's why they're still working for me, is because they know how to do their job well. And they want to make sure that you are taken care of from the beginning until the end of the process. So we're not just going to submit an application for you and then say, see you later, you're on your own. We are here for the long run. Because, you know, one thing that I can say we've always agreed with the president on is that healthcare is complicated. And so even once you have your insurance, if you get a bill that you don't understand or you don't think is correct, that's what we're here for. We are here to help you through the entire process because, you know, bills can be wrong. bills can be adjusted. So, those are things that we are available to help with, to explain the difference between coinsurance and deductible and maximum out of pocket and drug formularies, and how do I get this drug covered and how to file an appeal. Those are all things that we help with. So use our service. It is free, and we are here to help you through this.
Thank you so much, Shelley. Grateful for you, grateful for the work that Palmetto Project is doing in the community, and having you all as a resource we're very lucky to have you. So thank you so much for that. And we have recorded today's session. Hopefully it actually recorded, and we'll be uploading the video to YouTube, so that if folks who weren't able to attend today will be able to still get the information. It's really timely and important. And again, like I said, I'm probably going to rewatch it just because there was so much information in those slides alone, and I want to be able to know the information for myself, but also be able to share it with folks. And
Right.
so grateful that you were able to be here today and take your time to share this information with us.
Absolutely. Thanks, Chase, so much for AFFA's support. For a long time, we've been working with AFFA for a long time on healthcare. So it's an important issue for both of our organizations, and I'm so glad that we've been able to partner to do this.
Absolutely. Absolutely. Well, along those lines, AFFA is continuing to offer different programs. We are still experimenting with this virtual sort of way of doing programming. And so our next program is coming up tomorrow. We'll be on Facebook Live at 12 o'clock p.m. We're doing, maintaining mindfulness, being mindful during uncertain times. We'll have guest Eric Sullivan from Proud Counseling will be joining us, as well as Kanae Miller from Transformation Yoga. Again, that's going to be on Facebook Live. And it will be a nice little midpoint to your day. Hopefully you can step away and join us and get some tips on how to take care of yourself during this time. We also are planning some other programs around wellness and health. We've got some program coming up hopefully here soon around navigating the experience with kids during this time, parenting on the 24/7, parenting in a pandemic, I think is the title we're working on. So anyway, AFFA really is trying to connect with our community in a meaningful way, not just put programs out there for the sake of programs. We're hearing from people the needs that you have, and we want to be responsive to that. So make sure you like our Facebook page and stay up to date on what we're offering. So thank you for joining us today. Thank you again, Shelley, for sharing this information. And we hope to see you all again soon. Thanks so much. Take care.